Hello, welcome to Government Connection. My name is Vicki Evans. Wandering is perhaps the most common dementia-related behavior that results in police response, such as auto accidents, false reports, erratic driving. And we are talking about the elderly, so there's always victimization when the elderly wander off, indecent exposure, and so on. Well, the Alzheimer's Association is working with law enforcement to enhance the safety of wanderers. They're working together, and we are going to learn more about this as we welcome Lieutenant Jeff Coleman. Lieutenant, thank you for being here. And Lieutenant Coleman is with the Tucson Police Department. He is with Operations Division Downtown. And then we also welcome Felipe Jacome. Felipe, thank you so much for being here.
Good to see you.
And Felipe is the Southern Arizona Regional Director of the Alzheimer's Association Desert Southwest Chapter. So again, thanks you both for being here. Let's talk about the big picture, Felipe. You know, Alzheimer's and wandering. I think most people think maybe that's not that serious of an issue. So talk about the big picture.
Well, people would say that, and I think that the national statistics is something on the order of 60% of people with Alzheimer's disease or related dementia do wander at some point during the course of the disease. And so when you think about it, it's 5.1 million Americans with Alzheimer's disease now. It's a lot of folks with the potential for wandering. And as Jeff's going to talk about in a few minutes here, of course, you know, there's a significant social cost there. So, of course, the families that are terrified and worried about where their person has gone. But there's also, you know, a significant police response that goes into, oftentimes, as you were saying, false reporting. A person with Alzheimer's disease may not know they're making a 911 call, and they may really think that someone has robbed the house or has stolen something from them, when in fact that's not the case at all.
Right.
It's the disease talking, not the person, unfortunately.
Right. Well, and I think this is a great time. I think many of us think we know what Alzheimer's is, and we sort of know it affects maybe some plaque, or what is that all about? So describe what Alzheimer's really is. Okay,
so Alzheimer's is a neurodegenerative brain disease, and it's one of about 80 known types of dementia that we now know about. And you know, one of the classic questions is it dementia if I have Alzheimer's disease? Well, Alzheimer's disease is one of the many dementing illnesses. So yes, we use the terms interchangeably. And in terms of the other types of dementia, there's a bunch of other types, and oftentimes people can have both Alzheimer's disease and another type, or Alzheimer's disease and clinical depression, those sorts of things. So in terms of plaques and stuff, the 100 years ago and 102 years ago now, when it was first described, it was described on the basis of a person who presented actually at 51 years of age with full-on Alzheimer's disease, and it was a woman in Germany who presented to Dr. Alzheimer's, and they discovered that among the trademark hallmarks of the disease was in fact these plaques and tangles that form in the brain. That's still the standard now for Alzheimer's disease.
Right. And as we are, you know, and many famous people we know of. For me, I can think of President Ronald Reagan.
Sure.
You know, so you know, and who are we looking at here? We've got some others.
Okay.
Oh my gosh, Charlton Heston, right?
Yeah, and Scotty from Star Trek, and Rita Hayworth, of course, and Burgess Meredith, and Joe Louis.
Ralph Waldo Emerson.
Yeah, Ralph Waldo Emerson. All kinds of people have had it, and you know, one of the issues is, of course, it's not mental illness; it's a brain disease, and completely separate part of it. And something that we're going to talk about a little bit is the amount of denial that goes along, because a lot of people really deny that the symptoms that can be very real to people, they'll deny that in fact it might be Alzheimer's disease because they're afraid of the stigma of it being associated with a mental illness.
Right. So let's talk about then the impact of this devastating disease, and you know, the conditions that this disease presents in our community, and you know, how this partnership developed between TPD and the Alzheimer's Association.
Well, ironically, this time of year, because we're going into the Memory Walk season, Jeff here had been a Memory Walk volunteer for years, going back to 2003. And so we had a good relationship with him, and it was a pretty easy sell when we got in conversation about the need, because there really is so much community impact.
I mean, Jeff, you walked because why?
Actually, I started volunteering there doing security because it was a cause that I believed in, and it was an opportunity to give back to the event by volunteering the security.
Right.
So,
Okay.
yeah.
All right.
So I never actually walked.
Okay, but you were
Always
there.
protected.
You know, you watched the walkers,
He'd like
right?
to.
Absolutely.
You watched the walkers. You know, but talk about the impact, Felipe. Do you have any statistics that might help describe the impact of this disease on our community?
Indeed, you know, in southern Arizona, my office of the Alzheimer's Association, we handle the southern 6 counties of Arizona. So in that area, about 22,000 people or so have Alzheimer's disease and have been diagnosed with it. And that's just the folks that have been diagnosed. There's probably many more that have not been diagnosed. So if you think about that, that's 22,000 people with the disease. Think about the number of caregivers associated with that. That's about double that number of people that are affected by the disease, because they're the family caregivers that are caring for the loved one and are concerned when the loved one has the possibility of wandering and becomes at risk at wandering.
And you said earlier when we started this show that 60% of people with Alzheimer's dementia will wander at some time.
Yes, that's right. And some of the other kinds of dementias, you don't necessarily see wandering, but you see other kind of behaviors that result in police reports. People with frontal temporal dementia, which is a kind of dementia where you don't notice memory loss right off. That's not the first symptom that presents. Usually with Alzheimer's, it is memory loss. With that one, a total lack of inhibitions and stuff, so people leave their house open, and therefore there might be more burglaries, there may be more possibilities of that. There are people that aren't apt to wander, but there are people that will very often have suicide ideation. They'll talk about suicide and stuff early in the disease course. And of course that has some impact too in terms of law
And
enforcement.
wandering is not just walking off, it's driving off too, correct?
Absolutely, absolutely, and that's a big issue.
Okay. All right. Well, we were talking about the memory walk, and we wanted to know, I think now's a good time, we want you to see what the memory walk is all about. We got to be there a year ago, so let's take a look, and we hope you will come out and support the memory walk. But first, let's take a look.
You suffer from some disease that debilitates you. Somebody needs to look out for those people. And looking out for somebody that has dementia is a very, very stressful, can be a very stressful activity for any kind of a family. So this event today is called the Memory Walk, is to say thanks to all the people, all the caregivers, and to let everybody know that we are making progress, that science is beginning to understand more about dementia, and finding ways that we can prevent its rapid deterioration of an individual. But this is a day of thanks.
Unfortunately, when I was working the helpline, most of the calls we got were from people caregivers who had exhausted all their patience, energy. They were at the end of their rope, and they would call and we'd schedule an appointment to come in, and then they would learn different techniques to care for people, their loved one that they were, that relieved a lot of stress. A lot of people don't understand how the disease works, that the brain is actually being devoured, it's eating itself. A lot of people would come in complaining that their loved one was being oppositional or defiant, and they're really not. They can't help the behavior. And so maybe a disciplinary approach or punitive approach doesn't work. If they'll try reasoning with the person, and reason doesn't work. It's basically taking care of their basic needs and making sure they're comfortable, and have a human voice to talk to is the best thing you can do.
This is a real problem, and everybody needs to understand that we're doing everything we can to find cures and support the caregivers that look out for Alzheimer's victims. Thank you.
And it is Memory Walk time in Tucson, and we've got some information we want to share with you about when, where, and how you can become involved. This is the Alzheimer's Association Desert Southwest chapter, Memory Walk, and as it says, we're on the move to end Alzheimer's. And this year, it's October 25th, 8 a.m. at Reed Park, and you can do a 1 or a 3 mile walk. And I think we will bring up some contact information so you know a website to go to or a number to call about if you want more information. So perhaps we could see that now, right? So there is to call the Alzheimer's Association about the Memory Walk or any other thing that you think they might be able to help you with. Please call 322-6601. They're located at 3003 South Country Club Road, Suite 209. You can always visit the website, alzdsw.org, and the helpline is a 1-800 number. That's 1-800-272-3900. So, Felipe, before we talk about how the police used to deal with wandering, or if they even had a name for it, you know, when people contact the Alzheimer's Association, what is it that you can do for them? What do you do?
Okay, we have 5 direct service programs, and you just gave a nice plug for the first one, which is Helpline, Information and Referral. We have the capacity, it's 24/7, people can call us anytime. If we don't happen to be staffed in the office, somebody will be answering the phone in Chicago. But the nice part is we have 150 different language capability on that, so people can ask any kind of question they have
That's
about
number
dementia.
one.
That's a crucial one. Number 2 is a family care consultation, which is a fancy term for really care coordination for family caregivers to help people do the planning for their loved one, get their wills in order, know about an emergency response plan, those kinds of things, do the kinds of planning that they need to do to make the house safer for them. And part of that is, of course, Safe Return, the next piece, which is of course, our identity bracelet program, which is essentially a one payment becomes your lifetime registered with Safe Return. And our friends in the law enforcement community and others know to look for those when people are out wandering in terms of the bracelet and other identifying jewelry, which I think we're going to show in a few moments here. Then we do caregiver support groups. Very often it's a very helpful thing for family caregivers grappling with this disease to be able to get together with other family caregivers and share notes and talk about issues that come up with that. And help each other kind of go through the process. And then lastly, we do the Mayor's Caregiver Education Conference and lots of other educational activities.
Right, right. So lots that the Alzheimer's Association done. It's said that by the time we're all living longer, and by the time you and I reach 80, one of us is going to have the disease of Am I correct, Felipe? 80? Isn't that about?
Well, yeah, the
50%?
most recent stats
Oh
is,
my
yeah,
gosh.
over 80, Americans over the age of 85, about 50% show some symptoms of dementia.
Right,
whether it's
right.
Alzheimer's or something else.
So, Felipe, you brought up a medical alert and safe return, and this is where the police come in. So, Jeff, talk about what it was like with dealing with people that either had Alzheimer's and or dementia. What did police do, you know, and how it's changed and why it's changed?
Certainly, there were a lot of things that did change, and there are a lot of things that still need to change, of course, and we identified a need for this training, and that's one of the reasons that we're putting it on, to make things go even smoother for us when we're dealing with missing person calls, because they do take a tremendous amount of time on the officer's part. So part of what we were able to do through the training is identify certain elements of the Safe Return program that a lot of officers, even myself, were not familiar with. One of those is the clothing labels. Would we find a wandering person that had no identification on, a lot of officers knew to look for a bracelet, but they never thought to look and see if this person has a clothing label from the Safe Return program. So that's an example of something that we've been able to change through the training.
What about approaching the, I mean, how do you recognize if someone, I mean, that would be my first question, I think.
Sure. Most of the time it's going to be based on a call that we receive. Every once in a while an officer will actually wander across somebody, but normally it's a family calling, or it's a store calling because they've shoplifted and they don't even understand what they're doing. It'll be a citizen that's calling because of erratic driving. We'll have somebody driving the wrong way on the roadway, on a divided highway, for instance, and they won't even, when we get them stopped, if we do before something happens, which is, of course, a big concern. That's a high priority call, obviously. A lot of times they won't even realize that they're doing it. So I would say easily 95% of the times we come in contact with a person with dementia is based on a call that we receive.
Okay. So my next question, I think, is how do you talk with someone who doesn't know what they're doing? I mean, how do you make contact so you can help them before, let's say, family members arrive?
Well,
is that part of this training, I guess,
that is
what
part
I'm
of that
asking?
training. It is about the way you approach a person, the way you talk to them, which is calmly, giving directions in small bites, simply. A lot of times officers will tend to, at least if they don't understand what they're dealing with, they'll tend not to be as patient with someone that might not understand right away, and that's part of this training, is recognizing that may be what they're dealing with. Another thing is that a hurdle that we had to cross is if you're transporting somebody. A lot of officers in the past, we were just taught if you're putting someone in the police car, handcuff them for your safety. Well, not everybody with dementia needs to be, and a lot of times they'll react really adversely to that, so you need to know that and understand that. Just your tone of voice. Also, another big thing, officer safety is something that's really drilled into, especially the new officers. A person with dementia will have a real tendency to rummage through their pockets. And that's something that if a new officer doesn't realize what they're dealing with, that gets their sense of awareness really heightened because they're worried about them, looking for a weapon or something. So that was another element of the training that we had to make them think about when you're dealing with these situations. That's a behavior that's normal for these people. You might be uncomfortable with it, but you need to deal with that on a different level.
Right. So let's talk about this new training program more. So, I mean, how long is it? Is everybody doing it? Does it require reading, so to speak?
Well, actually, it's in a video format, and we have what's called the City of Tucson Employee University, which is a web-based training that the city uses now. We have just about all of our classroom-type training, everything that's not tactical for us, like shooting and whatnot. So that's presented on there. So it was in a video format with a test and also a survey at the end to see how much they got out of the training. So that's how we presented it. It was given to all of our commissioned officers, which are about 1,100, and all of our folks in communications, which is about another 50, because they're the folks that are taking the calls when a family calls in, and it's important for them to understand what is being told to them and what kind of direction to give, especially if someone has somebody lost on a corner. We had this happen just last Saturday when I was working. An elderly person, I was about 78 years old, that didn't know his way home, and someone stopped him for us on the corner. So they need to know what to tell those folks too while they're waiting for us, ways to keep them there and things of that nature. So, and then we're in the process, and I think Felipe is going to talk a little bit more about this too, but in the process of sharing this with other agencies in southern Arizona and actually all around the state.
Right. So Felipe, what's happening when the family makes the call and the police are there, or they find the person, and then what is who's talking to the family? I mean, there seems there's training in that way too, I would think.
Well, yes, and if they're on safe return, when they make that call to the National Safe Return number to report the missing relative, then immediately they turn around and call us, the local office, as well as the local law enforcement, whatever seems most appropriate. But the conversation typically is with us, with them, with the family members while the search is being conducted. Although we were saying too that one of the things that the police do here is you have somebody with the police officer with them while the others are searching, so that the communication can go back and forth. Because there's all kinds of things that we've learned about this. Persons with dementia, for example, tend to wander in the direction of their dominant hand. So then they're going to go to the right if it's a right-handed person. But finding out those things and knowing to ask that question is not something that you commonly think of. Now, they'll drive in the direction of the dominant hand as well. So are they going to head toward Phoenix? Are they going to... All of these things are things that have to be thought about now, and are something that an officer trained in this will know to go to right away, while we talk to the family about what else can we do, what were they wearing, had they slept the night before, all of those kinds of things. Which
what is important about had they slept the night before?
Well, had they slept, or they agitated. People with Alzheimer's disease and other dementias too, time changes for them, so they have to be up all night. They're apt to be, getting up at 2 in the morning, putting their clothes on and being ready to go to work because they think it's time for them to go to work, when in fact it's 2 in the morning and the rest of the house is quiet. So oftentimes you'll have incidents at weird times, the times that are very different than what you and I would do in our common daily lives. They're not going to be wandering necessarily when the rest of the family is around. Most family caregivers now are people that work and they're not home. So what happens in the house? Now, we, during family care consultation and other things, help the families work out a way where there's an alarm system or something so they know when people leave their rooms or the house, they're leaving the house, rather than trying to lock people in during the day.
All right. But you said something, wandering. Oh, I know. You said this was a very, for the police department, dealing with wandering cases can be very, very expensive. So describe how this is helping and maybe somehow cutting some of those costs and why that's so expensive.
Certainly, and that's the way it would help. Besides the emotional toll, obviously, it takes on a family, which is first and foremost, there's a lot of cost involved for the police department. It's a priority situation for us, and a wandering person can draw 15, 20 officers, depending on how far we have to ramp this up.
Time is of the essence,
Sure.
right? And
Absolutely.
manpower.
And that depends on so many things here. We have the issue of weather. A lot of times on hot summer days, we put that into the equation that this person needs to be found fairly quickly. And so we'll draw a lot of resources over to these scenes. It can include our dog units, our volunteer segment of our police department, command post, you name it. So we'll really bring out a lot of resources if this continues to go. And it really adds up. So there's a lot of benefit, obviously, in us preventing it and or resolving it quickly.
Right.
So,
have you seen how long have you been implementing this?
Gosh, we started in June, and it really ramped
June
up
of this
after
year,
July.
huh?
Yeah,
Right.
although we've actually been working on this for, a couple of years now.
yeah, we've actually, it was about a year and a half putting it together. So
And you've noticed a change? I mean, what kinds of positive results have you noticed in the last, June, July, August, September, maybe 3 or 4 months since
Maybe the most
officers are
important.
trained?
Maybe the most important one, there were 32 wandering incidents of people that were registered for safe return in the whole state last year. All of them were resolved successfully. That is, nobody was injured, nobody was hurt, they were returned to their family, they were reunited, and typically they were reunited in less than 6 hours, which is pretty amazing given how big the state is, and how widespread. Nationwide, to give you a feel, it was 1,314 times it happened this last year where people were reunited. And typically, the first people that find out about it are, of course, first responders like Jeff here, the police department's hearing about it first. But because Arizona is as big as it is, because we have such huge rural expanses, and because people can get so sick so quickly if they're dehydrated, for example, and go wandering in the desert in July.
It's really important.
I mean, it's always an emergency situation.
Right.
Now, the other half of this is, of course, working to set up some kind of an Amber Alert system for wandering elders. We have it now for the kids, and they're now moving in the direction statewide, in part thanks to this kind of effort, to do it statewide as well.
So when you talk about sharing the program statewide, did it actually start in Arizona here in Tucson? Are you guys the kickoff guys that made it happen?
yes, we started the training
Oh,
with
darn.
yeah.
Great. And you put together a training manual, so to speak?
Well, the video training we were talking about, that Jeff was talking about, was designed and produced by Officer Bob Greenwood of the City of Tucson Training Academy, who Jeff hooked us up with early on.
Absolutely. He did a phenomenal job, and then we've now passed this on to Arizona Post, which is in Phoenix, is the entity that oversees all police training in the state, and they're making it part of their training criteria to be available for everyone else. And then we're reaching out ourselves to some local southern Arizona agencies, like the Sheriff's Department, Pima County Sheriff's Department already. So
Okay, great.
That's right. The second department actually started using is now Oro Valley Police Department,
correct.
which is in an area that you have a high concentration of elders and a high concentration of people with dementia as well, both, which we didn't know until we started getting into this program and started working with them.
Right. Well, before we give you some great telephone numbers, emails, and all kinds of good information, I want to make sure that you join us next week on Government Connection, and we'll be doing a kind of a report card here. We're seeing at least how First Things First is coming along. This was an initiative that was approved by Arizona voters to fund early childhood education with tobacco money revenues. So we'll be catching up with First Things First next week. And then, as I say, we do want to make sure that you know about medical alert and safe return. And you can always contact the Alzheimer's Association Desert Southwest Chapter. Once again, the helpline is 1-800-272-3900. And just non-emergency, non-help kinds of things, please contact the Alzheimer's Association at 322-6601. That's 322-6601. They're located at 3003 South Country Club Road, Suite 209. And the website is alzdsw.org. And I think I've got some more information here about medical alert, safe return. And what are we looking at? This is is that a bracelet?
That's a little bracelet.
On the bottom.
On the bottom. And Medical Alert, they've only joined forces with Safe Return in the last 2 years, so hence the
Oh, I
hence the
see.
name.
Okay.
It used to be just
But
Safe
go
Return.
to, and you can always go to the National Alzheimer's Association website.
Right.
Okay. It is alz.org/safe return. That's alz.org/safe return. And then we don't want you to forget about the Memory Walk. And it's October 25th, 8 a.m. Reed Park 1 and 3 mile walks. And as Felipe has told us, this is a great opportunity to learn and to educate yourselves and your fellow neighbors and citizens about a disease that basically affects all of us in one way or another. So, Felipe, do I have to be we've only got a couple minutes. I just want to make sure about Safe Return and medical. Do I have to be a U.S. citizen to sign up? And what happens if I don't speak English for, Safe Return and Medical Alert?
Anybody can sign up. Don't have to be an American citizen to sign up. We do have Spanish-speaking staff, as we were talking about earlier on Helpline, as well as in our local office in Tucson. I think it's $49.95 for a lifetime registration with Safe Return, and we do provide scholarships for low and moderate income people as well. So really, we can do all of that for you. We're able to do those scholarships thanks in part to Arizona Diamondbacks and some other local grant sources.
Great. So is Safe Return just for children? Can anyone sign up?
Anybody can sign up for Safe Return. And in fact, one of the things that with people with dementia, one of the symptoms is people don't kind of trust other folks. So if you suddenly want to put a bracelet on somebody, sometimes it's wise. One of the things we recommend is that the family caregiver also get a bracelet too. And with so many people having medical sensitivities and allergies and stuff, all of that can all go on the Safe Return. If you're allergic to codeine, if you're allergic to something else, important kind of a thing. Is people with diabetics, for example, and others can also have that.
It's hypertension, strokes.
That's
it
right.
Could be anything.
Any
right?
of those things.
Well, this is a wonderful thing you're doing. I think I think we'll all benefit. And my hat's off to you two guys for making this happen. So TPD and the Alzheimer's Association, Medical Alert and Safe Return for people with Alzheimer's and dementia. Thank you both so much, and we all benefit. Thanks.
Thank you for having us.